light on this topic, we have a guest with us in the studio in the person of pharmacist Kolawole Oluwafemi, who is the Business Development and Client Relation Officer, Ondo State Contributory Health Commission. Good day. It's nice to have you.
Yeah, good day, presenter. It's always good to be here.
Yes. You know, we talked about the informal sector, but then there's kind of a twist. I don't know if I should call it a twist, because now you talk about there are different plan type of the informal sector.
Yeah, so of course at the Ondo State Contributory Health Commission, we'll continue to look for innovative ways to ensure that our mandate, which is to make all residents of Ondo State have a form of health insurance cover, to ensure that we achieve that mandate. So what we have done now is we now have different plan types.
Okay.
There is now the Oranghis Diamond, there is the Oranghis Ruby, there is the Oranghis Sapphire, and there is the Oranghis Emerald. These are the last three that I mentioned are different top-up plans that are now available to the end that enrollees that want a higher level of care, a higher number of hospital admissions are now possible with those top-up plans. So a higher level of care, that's the main thing. So we're looking at enhanced level of care. So any enrollee that wants those
more like it covers more services than the ones already on ground.
Yes. So there are differences in the number of hospital admissions, in the number of in the number of days, for example, transfusion services, in the number of pints of blood that if a client needs to be transfused.
Okay.
So we have a higher number in these other top-up plans.
Okay.
You know, so we now have different plans under Oranghis Informal.
Under the Oranghis Informal.
So of course, there are comprehensive benefits package documents that we have for these health insurance plan types.
All right. You know, when we talk about the plan types, we talk about the informal sector, we also need to talk about sensitization, because there is no need when there are these plans and this health insurance scheme and nobody is assessing it. So how often is sensitization done, and how has the turnout been?
So for us at the Ondo State Contributory Health Commission, Business Development and Client Relations Department, sensitization is a continuous process. So this is something we keep doing to the end that people continue to get informed, so that our mandate will be achieved, like I always say. So recently, last Sunday, we were at the Redeemed Christian Church of God Power Sanctuary along Ademulegun Road in Ondo, where we sensitized the congregation about the Oranghis Informal Plan, how to access care, how to come on board. And we were at Ijuta Bolu last Friday also. We were at Akure Stadium quite recently, I think on Friday also.
For sensitization.
We were at Akure Stadium where we went there to leverage on a football competition that was being hosted by one of our senators. We were there to ensure that people get to know
about the Orange Health Insurance Plan.
So it's a continuous process.
Okay. And how has the turn-up been so far?
Yeah. So far, we have, in fact, our scorecard is out for quarter 2. Scorecard for the Ondo State Contributory Health Commission for quarter 2 is out, and we have, I think we have about over 1,800 new enrollees coming on board into both the Oranghis Formal and Oranghis Informal sector. Because we like to give the scorecard together, because Oranghis is a plan, only that we have different plan types.
Different plan type. Okay, so still talking about the scorecard, would you say the Orange Health Insurance Scheme is being utilized by a large population of the Ondo State residents?
Yeah. From the quarter 2 scorecard that was released recently, you can see the number of hospital visits that we had in that quarter.
Okay.
We had over 18,242 hospital visits under the Oranghis scheme alone in that quarter. So utilization is increasing. We have State Specialist Hospital Okearo coming atop the list of our facilities that we visited in that quarter. You have State Specialist Hospital Ondo also coming up. In fact, we have a private facility, Sky Hospital, even in that top 10 facilities in terms of encounter.
Okay.
In that quarter. So yeah, the data speaks volume. So we have data, to back these things up, and that's quarter 2 from April down to June. So of course quarter 3 scorecard will also be released in any moment from now.
All right. When we talk about health insurance, we cannot leave the facilities out of it, because the facility is also a major aspect of the health insurance. You cannot receive healthcare without healthcare facilities. So would you say the Orange Health Insurance Scheme have enough facilities to cover up for the enrollees that are coming in?
So like I have said before, the number of the percentage of the informal sector enrollees resident of Ondo State is far more than that of the formal sector. So we are expecting close to 10 times more of the figure that we currently have, if not more. So because of that, we do not want to overwhelm the already existing facilities. So we continue to do accreditation process of new facilities. So we recently still did one in Ondo. We visited the facility in Ondo, a private facility, to see how we can have more facilities come on board. And for providers that are interested, private facilities that are interested in coming on board, what you need to do is visit our website, www.odcac.on.gov.ng. Visit our website, you will see the provider's interest form. You see the form that you can complete online to indicate interest to
be part of the Orange Health Insurance facilities.
That drops to us. We get that document, of course. So it is that document that we're now going to use before our team will now come to your facility for physical assessment to see if indeed you have the number of personnel, number of doctors,
and equipment.
And then of course the structure, the infrastructure. That if you have those things, we have our own document, our own checklist that we use in assessing those facilities in during this accreditation.
I was actually getting there, because I know a lot of enrollees would be scared that what if the services that they desire is not being rendered in those facilities. So are we saying that whichever facilities that these enrollees pick, both major and minor, let's say, healthcare services can be rendered there? Okay, so
levels of care, there are 3 levels of care generally. There is the primary, there is the secondary, and there is the tertiary level of care. So if a facility, because we have both primary health centers and we also have secondary facilities, we have tertiary, secondary and tertiary facilities are created under this scheme. So if you visit a facility, say for example, you live along Igoba, and then you choose primary health center Igoba as your preferred facility, and
the services might be limited.
Yes, they will only be able to render primary services to you. However, if you require secondary service, all they need to do is to refer you. There is a referral letter in which they sign, they get the authorization from our third-party administrators, who they commonly refer to as HMOs. But of course, because of their peculiar role in the ODCSC, of course, they are intermediaries between us and the facilities. So we refer to them as TPA. We have 3 of them. We have LifeWorth, we have United, and we have IHMS. So those are the 3 TPAs that we use. So they get this authorization code from the TPA, and they refer you to the next facility that can handle. For example, they can refer you to, let's say, University of Medical Science Teaching Hospital, that is now Futa Teaching Hospital in Akure. They can refer you there for you to be able to assess either the secondary care or the tertiary care, still at no cost. So it should be noted that if you're leaving that primary facility to visit a secondary facility, you're still not going to pay a dime. Like I've always said, the Orange Health Insurance Scheme is a co-payment method of health insurance, in the sense that if you get to the health facility and the cost of your health care is, say for example, 10,000 naira, the entire 10,000 naira, once it's the covered service, the entire 10,000 naira is going to be paid for by the Ondo State Contributory Health Commission. You do not get to pay a dime like some other forms of health insurance where it is a co-payment method. You pay as little as 10% and you can pay as high as 50%.
Okay. So even if they are being referred to, let's say, a secondary health center?
Yes.
Okay. Are you saying they would be attended to immediately?
Yes. So
even though that's not like the first center that they registered with?
Yes. So the way it works is, once you get to that secondary facility, you present your referral letter to them.
Okay.
They can see the facility from which you're being referred. They can see the authorization code allowing them to attend to you. So that is how they need to do. They see the referral letter, and then the level of care you need is rendered to you at no cost.
Okay, still talking about facilities, are the enrollees allowed to pick facilities from the accredited facilities that the Orange Health Insurance Scheme provides?
Yes, so like we said, we continue to improve on our services and increase the number of health facilities that we have. So we give you the option. Enrollees have a right to choose whichever facility they find
they desire.
And of course, like we've always said, if there is a need to change facility, of course, no more than once in a year, clients can come. In fact, our scorecard that was, I believe, was shown earlier on the screen displays the number of change of facility requests that we also got in the first quarter. So you can also change your facilities. Let's say you're relocating,
to another local government.
There's a need for you to change facility, so you can always change your facility. So enrollees have the right to change to choose a facility amongst our list
of accredited facilities,
which, like I said, we continue to increase.
Okay, so let's talk a bit about the success stories of Orange Health Insurance Scheme.
So, so far, in fact, I'm still going to refer back to the scorecard. So far, you can see the number of cases in quarter 2 alone. We have malaria coming up as the most utilized service, with over 9,000 cases, 9,121 cases for malaria. You can see the number of under service utilization. You can see the number of surgical cases we treated. We handled over 500 cases, surgical cases, in quarter 2 alone. So ODCAC continues to blaze the trail. We'll continue to look at ways in which enrollees can receive the best level of care at no almost no cost, of course, apart from the initial premium that has been deducted if you're a state civil servant in the formal sector, or if you are in the informal sector, the initial 18,000, 36,000, or as the case may be now, the different number, amount of increased health plans that we have, Oranges insurance scheme plans that we have. So we continue to blaze the trail. Currently, we have over 103,000 enrollees registered under the both Oranges formal,
the Orange Health Insurance Scheme.
Yes, that's the right way. Yes. Under the Orange Health Insurance Scheme, we have over 103,000 enrollees registered under the scheme. So we continue to base the trade. There are a lot of success stories. We've done over 600 surgeries already on the scheme since inception. So ODCAC continues to blaze the trade. We continue to do so much to ensure that clients get quality service at no cost.
Like I said, when we talk about health insurance, we always have to talk about facilities. And I must ask again, these facilities, are they just public facilities alone, or both public and private facilities?
So you have the right to choose either public or private facilities.
Okay, so the accredited facilities, it's not limited to public facilities alone. Yes. They have both public and private.
Yes, all across the 18 local government of Ondo State, we have both public and privately owned facilities that have been accredited on board, to render service. And we also have laboratories, we have pharmacies, that we have accredited. If there's a need for you to pick a secondary drug that is not available in the hospital,
but then you have to be referred.
Yes. Okay. So the way that one works is, we said we have always said that we make two forms of payment in our health insurance scheme. We make the capitation payment, which is a prepayment for primary services. We also make fee for service, which is a post payment actually, which is for secondary and tertiary services.
Okay.
So let's say you visit a hospital and you require some secondary drugs that are not available in the hospital pharmacy, because we get a lot of some of those complaints.
Yes.
So the way it works is we have accredited certain community pharmacies.
Okay.
Across the 18 local government of Ondo State, such that the clients can pick those secondary drugs. Again, I'm stressing on the fact that it has to be secondary drugs, because those primary drugs drugs for primary services have already been prepaid as per capitation to that facility, so they will give you primary drugs. But for secondary drugs for secondary services, you can go to an accredited community pharmacy with the prescription already, of course, with the policy number written on the prescription
the referral
sheet.
letter.
Yes, so you get to that pharmacy and the community pharmacy, and you're able to pick your drug. So instead of post-paying the hospital now for secondary service, we are going to be post-paying the community pharmacy, the accredited community pharmacy.
Okay.
So that way everybody is happy. The pharmacy gets his or her payments, the client gets the drugs, and we at the ODCS are happy.
You render the services.
Exactly.
Okay, still talking about the enrollees now. Is health insurance only for the sick?
So I gave an analogy recently during one of our weekly marketing meetings that we have at the Ondo State Contributors Commission. I said health insurance, I likened it to you going with an umbrella to work. So let's say you're going to work and you have seen the weather forecast that there is going to rain, or you look at when
you come out, cloud. We do it the African way.
Yeah, that is likely going to rain today.
It's looking dark.
And
it may or may not rain.
Then you go with your umbrella. That's not health insurance. That is just trying to be safe.
Yes.
But health insurance is you going with an umbrella in case it rains. Even if there is no likelihood that it's going to rain.
Yes.
You going with an umbrella, that is health insurance. So health insurance is not only when you fall sick that you should get health insurance. I'm likening that situation to
yes, it's not only when it's raining you should go with the umbrella. Sometimes you go with the umbrella even before it rains.
Exactly. So health insurance is not only for the sick. Even the idea of health insurance is in case you fall sick. In fact, the idea of insurance generally is in case this happens. When you buy insurance for your car, you are not saying you have an accident, but you're saying in case these things happen. So
something should cover up
something should cover for the damages.
Yes.
So that's the idea. So health insurance is not only for the sick. So don't say, when you came out insurance, they're asking to buy health insurance. I'm not going to fall sick. That's not the idea. Nobody is saying you fall sick. You're saying in case, like we
just
always say,
in case it happens.
A rich man is only one major chronic disease away
from being poor. Okay, so just like you said, a rich man is only one chronic disease away from being poor. So for those of we have potential, should I say, enrollees now, how do they register? Okay,
so now we have made it so seamless to the end that by visiting our website alone, you can chat us up. We can send you a soft copy of the enrollment form.
Okay.
You can fill the form. We'll also send you a soft copy of the payment details, the account details that you're going to pay into. So you make payments. We've had a few of those enrollees like that we have not even seen them. All they have done is
through online.
Yes, they will just fill the form from online. They will share the transaction receipts, the payment receipts with us, and then we enroll them. And then when they come on board, we'll send them. Usually we send a text message to the number they filled on the form. We send a text message indicating that their policy year has begun and that they should come pick their ID cards, up at our office. And if there's any for us to look at logistics ways to send it across to them, we also have that conversation with them. So you can do that. You can also visit our office inside Ondo State Ministry of Health complex beside the governor's office. The name of the commission again is Ondo State Contributory Health Commission. You visit our office. The moment you get to the office, to that agency, you will see our client services staffs already. They will attend to you. They will give you the form. They will give you explanations you need. So, and we also have our marketing lines. I also believe that to be displayed on the screen as I speak. We have our marketing lines that you can call us. You can put a call through to us. I should also state that we now have a 24/7 contact center line for care. We have marketing lines for marketing purposes. We also have 24/7 contact center lines for care, which I also believe will be displayed as I speak. So these are phone numbers that are available for our enrollees to reach out to us 24/7. Depending on whichever time they want to call us. If they have any complaints about the quality of service
being rendered in the facilities,
they can reach out to us. We have our staffs at the Industrial Contributory Health Commission that will pick up your calls to ensure that you get the best level of care. So we continue to work on ways in which our enrollees get served the best possible way.
All right, thank you so much. Thank you so much. Do you have any comments that you would like to share?
So again, health insurance is not saying you are going to fall sick. During one of the sessions we had while we're coming up with this plan with Oranghis Informa, we identified the potential challenges that we can have in reaching out to people, and we know that religion is one of the challenges. As when you can insurance, me on sick, health insurance is not saying you will fall sick. We are not praying. Some people see it as though if they are buying health insurance,
they are praying
for themselves to fall sick. That's not. A lot of people that have car insurance, our director general at the Industrial Contributory Health Commission, Dr. Abiodun Yeneyi, will always say that he's been purchasing car insurance for close to 20 years. He has never made claims on one day. And of course, the prayer is that he will not need to make claims. So health insurance is not a way of saying that you're going to fall sick.
It doesn't mean you're attracting that thing
to yourself.
Yes.
You are just protecting. So it's just like you're taking your umbrella. Taking your umbrella
doesn't mean you're attracting
rain to fall. But you're just saying in case it rains.
Yes.
So that you will not get drenched. So that is the idea of health insurance. So buy health insurance for yourself, purchase health insurance, so that, because the Ondo State government is interested in all residents. We do not want you to suffer catastrophic health spending. There are other things you need money for. Healthcare should not be one of those things that, in fact, we have people that will not want to access healthcare because of money. They are sick, but they will not want to go to the hospital.
Yes.
Because of the finances that is being incurred
out of pocket money.
Payments. Yes. So we are saying that should not be a reason why you should not go to the hospital. Purchase health insurance for yourself for as low as 18,000 naira, per calendar year, per 12 months.
Yes.
And you're fine. Thank you.
All right, thank you so much, Pharmacist Kolawole Oluwafemi. I hope next time when we call, you would respond and be our guest on the show.
It's always a pleasure.
Thank you so much. With this, we've come to the end of today's edition on Oranghis. Like we always say, health is wealth. I am Isu Samunilari. Bye.